Hello, Dr. Rios. And today we're here with Dr. Alejandro Ríos. He's been here at this hospital. It was Joya Marina and Hospital San Javier for 22 years. That's a long time. He's the director of the intensive care unit here at this hospital and also in Nuevo Vallarta at Riviera, Hospital Joya Riviera. And he's a certified pulmonary specialist in Mexico. He's a pulmonary and critical care physician, correct? Did I miss anything?
Correct, internist.
Oh, internist, sorry. And if anybody remembers, we did a interview with Dr. Rios in 2006 for a virus, for a
SARS.
flu. SARS, and then 2009 was the flu.
The flu, correct.
And then we did in 2020 when all this started with COVID. So every time there's a big disaster, I look for Dr. Rios.
Thank you.
We do this. Very popular doctor and a great doctor. So, Dr. Rios, what can you tell us about the current status of COVID in our area here in Vallarta?
Well, now that we're hit by the fourth wave, it's actually, as you can see, the consensus, everybody's, not a lot of people getting too sick, not a lot of hospitalizations as on the previous waves. The first wave was a disaster because we have no idea about the disease. So we have multiple admissions, a lot of people die. The third wave with the Omicron, we had another big population of patients that got admitted to the hospital. A lot of people die again, different population. And in this fourth wave, it's actually been a little bit less than what we expected. Obviously, a lot of the people who got sick died. Other people got vaccinated or fully vaccinated. And some of the people that survive, they still have some immunity for it. So the mortality rate that we're seeing now is much, much less. The number of admission is much less. It's not that it's more benign. It means that we're prepared for it. We know how to treat it, and we are almost all of us fully vaccinated. I hope you all are fully vaccinated by now. As of last week, we have a major monitor, which is the Clínica 33 in the IMSS. And last week they have only 6 patients admitted, 2 of them intubated. As of today, we have 4 patients in the hospital, only 1 intubated.
Here.
The hospital continues to be a specialty hospital, multi-specialty clinic. In the past, it was transformed to a COVID hospital. In Clínica 42, which is another marker, there's only 7 people admitted for COVID on the floor, only 1 of them intubated. As of today, they're opening the COVID unit because the number of cases are increasing. Here at the Joya Hospital, we only have 4 patients admitted with COVID disease, 3 of them on the ventilator, and 1 of them on a high-flow nasal cannula ventilation. So they're pretty sick people. But 3 of them are admitted not for pulmonary issues. 1 of them with a heart attack, another one with Guillain-Barré syndrome, and another one with a co-infection. So the perspective looks much better than what we thought it was going to be.
And I'm going to add this question. The patients that you said, like they're here for a heart attack, those, but is it a result of COVID?
It's a comorbidity, yes.
Okay.
COVID is being related to something like we call hypercoagulable state. So we're seeing people with stroke, heart attacks, and we're seeing other conditions that are related to COVID, arrhythmias, etc. So yes, 2 of these patients were actually admitted for another disease, and while they're here, they were tested for COVID and they were positive. So they were completely asymptomatic, and they developed a complication associated with COVID.
Okay. Are there many post-COVID patients who are suffering from symptoms? What are some of what they call the long hauler symptoms?
Okay, I'm going to give you a small presentation about what post-COVID syndrome is.
Okay.
It's very important because a lot of people talk about the hauling COVID, the long COVID, post-COVID. Nobody really knows what it is. Okay, so the first thing is, what are post-COVID conditions? So the first thing that came out was this post-acute sequela of SARS-CoV infection. It was called the PASC. The name changed. This is from the National Institute of Health. And now there's another term, it's called post-acute COVID syndrome. It's called PACS. And we know that up to 30% of the patients that develop COVID will develop the syndrome. There is different types of long-term COVIDs, and one of them is the one that people refer as the long haulers. I will talk to you in a little bit about it. So what is really long COVID, and what are the effects of COVID in the different organs of the body. So how long does COVID last? So normally in a patient with COVID, about 80% will recover within 2 weeks, fully recover, completely no symptoms. So the majority will not develop symptoms in the long run and they fully recover. The other 20%, which is still a lot of patients, develop some other things. In this graph from the CDC, it shows that 1 in every 5 patients, previously healthy young adults, no medical conditions, young, healthy, were back to the usual health after 2 to 3 weeks. So it is actually very common, even if they are asymptomatic. So what do they recommend? Same things: distancing, washing the hands, and protection. With this long COVID, the symptoms can last for a long time, weeks or months, and sometimes years. This is another graph. This is from World PT. 1 in every 10 cases who develop symptoms, they last for 12 weeks or longer. That's a long time. You're talking about 3 months. Another graph from another source: 1 in every 10 will persist with symptoms after 12 weeks. So that's a lot of people. Another graph. This is from the New York, the Mount Sinai. COVID is around 10-50%, but not necessarily hospitalized cases. So 1 in every 10, 1 in every 8 will continue to have symptoms after they were hospitalized or not hospitalized. There are also individuals who remain out of the hospital, but after they got better, they developed severe, debilitating post-viral symptoms. So it is estimated about 10 to 30% will experience what we call the long COVID after recovering. So a lot of people get sick in the first place, they fully recover, and then later they develop symptoms. Even it's important to know that another question they asked me was, what about the severity of disease related to post-COVID symptoms? So anyone can get long-term COVID despite the severity of the disease. So you can have a very mild disease and still have a lot of symptoms post-COVID. Or you can have a bad disease and still have bad. Now, even the mildest cases can develop long COVID. Asymptomatic patients who get a positive test can also develop post-COVID syndrome. So it doesn't spare anybody. Anybody can get it, despite of the severity of the disease. So a lot of people recover from COVID, but it's still not feeling 100%. And it takes a long time. You talk to people on the streets and say, oh, I had COVID 2 weeks ago. I still feel tired, I'm weak, I'm still coughing. Then a month later, you see him again. I'm still tired, I'm still coughing, you see him 3 months later, same things, or even worse. So what are the things that usually people complain about with the post-COVID syndrome? They get short-winded. So me as a pulmonary doctor, I have patients coming to my office all the time because they still have shortness of breath after several months from recovering from COVID. Anxiety, extremely common. Chest pain, cardiologists can tell you that a lot of people are coming to see him because they have chest pain and they think they're having something like a heart attack. Cough can last for several months. I have patients in my office that there's no way to get rid of the cough for about 6 months or even longer sometimes. They have body aches, they have rash. So what happens when the COVID symptoms don't go away? So this is people who recover from COVID, return to normal health. This is normal after 2 to 6 weeks. So most people after 2 to 6 weeks, they recover fully and they have a normal life afterwards. Some people can last their symptoms for weeks or even months. Important, they are not infectious to others, even if they're having symptoms. That's very important. Symptoms may be onset after initial recovery. They can persist, they can fluctuate or relapse. What does that mean? Some people get sick, they get better. A few months later, they get sick again, they get better, they get sick again, they get better. Some other people, they get sick and they continue to go sick through the whole time. Some people get sick, better, and then continue to get sick and they have not recovered yet. Even people who have no symptoms, asymptomatics, can experience long COVID, okay? There are 3 types of long COVID. This is very important. The first one, it's 3 categories. It's actually due to the COVID itself with direct cell damage, meaning that they get COVID, they get symptoms, and the symptoms continue. That's one of the types of long COVID. This is what we call the ongoing symptoms. The second type is when a person is extremely sick, they end up in the ICU, they have chronic hospitalizations. We have a few patients that stay in the ICU for about 3 months. They recover fully, luckily. And from being in the ICU, they develop muscle weakness, cognitive brain dysfunction, a lot of psychological stress, and they keep going for months. So this is the related to chronic hospitalization. And the third category is in which symptoms appear after they fully recover. So the patient had no symptoms before and later on develop COVID symptoms. This is what the people call the long haulers. When you have somebody that had COVID, 2-3 months later they develop symptoms consistent with long COVID, it's extremely important not to attribute it to COVID by itself. You have to be sure that they don't have another condition. Hypothyroidism, there's many diseases that can mimic long COVID. So first you have to rule out other conditions. The long haulers, more than 80% of people with post-COVID symptoms, at least they have one persistent symptom. And it could be from any organ, the brain, the lungs, the heart, anything.